वेलकम टू दिस चैनल माई सेल्फ डॉक्टर टी एन देवनाथ, डॉक्टर मॉडर्न मेडिकल साइंस, मोटिवेशनल स्पीकर एंड लाइफ कोच। आज इस वीडियो में हम बात करेंगे आईवी फ्लूइड के बारे में। अगर आपका कोई भी इंडोर सेटिंग्स हो तो डेफिनेटली वहाँ पे पेशेंट एडमिट रहेंगे तो आपको आईवी फ्लूइड यूजुअली हम लोग देते हैं। तो कौन सा आईवी फ्लूइड कौन सा पेशेंट को परफेक्टली देना चाहिए, इसके बारे में इस वीडियो में हम बात करेंगे। कौन सा आईवी फ्लूइड का क्या कैरेक्टरिस्टिक है, इस वीडियो में हम डिटेल्स बात करेंगे ताकि आपका पेशेंट मैनेजमेंट बहुत अच्छे से हो सकते हैं। चलिए शुरू करते हैं आईवी फ्लूइड के बारे में। अगर आईवी फ्लूइड के बारे में हम लोग बात करेंगे तो आईवी फ्लूइड स्पेशली दो तरह का है, एक है क्रिस्टलॉइड, वन इज कोलॉइड। ओके, वन इज क्रिस्टलॉइड एंड कोलॉइड एंड अनदर इज डेक्सट्रोज कंटेनिंग और नॉन डेक्सट्रोज कंटेनिंग। ओके, नॉन डेक्सट्रोज कंटेनिंग and these all are the colloid. So crystalloid we have dextrose containing, that is DNS, 5% dextrose, 10% dextrose and 25% also. For normal saline we have lingual lactate, we have isolate have, these all are crystalloid. What are the basic characteristic of the crystalloid I will talk in the next slide. And in colloid we have albumin. We will see albumin because albumin you can see the patient having the ascites, having liver disease, having low amount of albumin in the liver profile. So definitely we allow or we actually suggest to give albumin infusion. Why and how it will act I will talk in this slide. Now we have three important space. Remember this is our cell. So inside the cell this is our intracellular space. This is our intracellular space. This is our intracellular space, ICP, intracellular space. And outside the cell is the extracellular space. So this is the extracellular space and this is the ICS, intracellular space. Okay, so this is intracellular space, this is extracellular space, and extracellular space is divided into one is intravascular space and second is interstitial space, right? So if you have dehydration inside the cell, you need some fluid inside the cell. Why? Patient has not taken any food or any fluid intake is there, so definitely there will be dehydration and intracellular volume will be reduced. So we need to give some fluid which will enter into the cell. And remember the colloid, what we have, the colloid we have albumin specially, and they will remain inside the vessel, that is in the intravascular space usually albumin remain. So if you have cellular dehydration, if you give albumin it will be of no benefit or less benefit. Okay, so this is all about colloid. So colloid will give where, because it is remain inside the vessel. If you need somewhere to increase the intravascular fluid, definitely we can give colloid. Now crystalloid, if you see crystalloid, that is colloid, COLOID, colloid. Okay, that is colloid. In the crystalloid, if you give crystalloid, they will pass into the interstitial space but they cannot enter into the cellular space. So if you give crystalloid, it will stay in the intercellular or interstitial spaces. Okay, for intracellular space to enter into the cell, we need to give dextrose. We need to give dextrose containing fluid which will enter into the cell and will reduce the cellular dehydration. Okay, so this is very important. Intracellular space we need to give dextrose, interstitial space usually remains the crystalloid, and colloid remain in the intravascular space. Now if you look at the 5% dextrose, so dextrose will go into the cell. So in case of dehydration in the cell, we can give 5% dextrose. Okay, but we cannot give 5% dextrose, or rather we should avoid giving 5% dextrose into the cerebral edema. In cerebral edema, actually what happens, you know, in edema, cerebral edema, the cells are getting swelled up. Cells are getting swelled up because of inside the fluid is there. So if you give dextrose containing fluid in case of cerebral edema, more and more fluid will attract towards this cell, inside the cell, because where there will be dextrose, they will invite fluid to come inside. So if you have cerebral edema and you are giving dextrose to this patient, now the cell already is swelled up and it will attract more water and there will be damage to the cell. So So this is very important. In case of cerebral edema, please never give dextrose containing fluid. Now, how will cerebral edema actually? The stroke patient, there is you don't know which kind of stroke is there, where it is ischemic stroke or hemorrhagic stroke. So any kind of stroke, it is better to avoid giving dextrose containing fluid unless and until you know the exact reason of this stroke. Okay. So cerebral edema will never give dextrose, but intracellular dehydration, the IV fluid of choice is the dextrose. This is very clear. Now DNS have sodium, we have chloride, and we have glucose also. Okay, so where we have hypovolemia, we can give, and remember, in case of vomiting, we can give very easily is the DNS. It will give you, that glucose will give you the energy where there is need of energy, that sodium will give you the sodium, okay, and it will also take care of the hypovolemia. So if you have hypovolemia, if you have low sodium and you need some kind of energy or to the patient, so it is better to give DNS, right? Now what is normal saline? Normal saline, it has sodium and chloride. Okay, sodium and chloride, but it won't give any kind of energy. There is no energy. Okay, no energy. If you want to give energy to the patient, if you think that your patient needs some energy, then you should give DNS, dextrose containing fluid. But the normal saline won't give you energy to the patient. Okay, it will give you sodium as well as chloride. Now where we will use this normal saline? That normal saline we will use in hypovolemic shock. Remember, in hypovolemic shock, IV fluid of choice is the normal saline. IV fluid of choice is the normal saline. Vomiting, definitely we can give normal saline, as well as dehydration we can give normal saline. Hyponatremia, because it contains sodium, so if case of sodium is decreased, we can give normal saline. And remember, one important is diabetic ketoacidosis, IV fluid of choice is normal saline. So in case of hypovolemic shock, the fluid of choice is normal saline. In case of diabetic ketoacidosis, fluid of choice is the normal saline. Now in some of the condition, we need to give half NS. Half NS means exactly half. That means the sodium usually contain 154, but if you give half NS, it will have sodium 77 and chloride 77 milliequivalent per liter. Here we can give in case of dehydration is because of the excessive sweating. If there is excessive sweating, we can give this half NS. Now there is half NS. Similarly, we can increase the amount of the sodium and we can call it as hypertonic saline. That is, sodium is 513 and chloride is also 513 milliequivalent per liter. Where you will give where there is hyponatremia, that is sodium is less and the patient is symptomatic for this hyponatremia, the fluid of choice will be hypertonic saline. Remember here, if you give hypertonic saline, the IV flow rate will be very slow. It has to be slow flow. It has to be very cautious, otherwise there will be demyelination of the pontin. Okay, so very slowly you have to give hypertonic saline. Now another important fluid we very often we use is the ringal lactate. Ringal lactate is the RL. Here we have sodium, we have potassium, we have calcium, we have chloride, as well as we have lactate. Okay, so many things are there in RL, that is ringal lactate. So where we will use the ringal lactate? Ringal lactate we will use where there will be loss of the sodium, potassium and lactate, that is mostly the diarrhea. If you have prominent diarrhea and due to this diarrhea you have the dehydration, so definitely the fluid of choice will be the RL, not NS. Remember, for vomiting you can give either DNS or you can give NS. If you have diarrhea, the fluid of choice will be RL. For diarrhea, fluid of choice is RL. And remember, in case of burn, the most commonly used fluid is RL, and it is for initiation as well as for the maintenance of the therapy we give RL. Okay, but where he contraindicated vomiting, we usually never give RL. Okay, or along with blood transfusion, you should not give RL. Now albumin, as we know, that is albumin. That is albumin. Albumin, we know it is a colloid. It is a colloid. Remember, it is a colloid, and it will remain inside the vascular space. Now in case of liver dysfunction, ascites is there, and there is less fluid inside the vessels. Okay, most of the fluid are in the interstitial space. And even in case of burn, we can give albumin, and albumin is very important to increase the plasma volume expansion. Now how you will give the fluid, or how to calculate the drop per minute? Okay, now IV drip, if you use the normal IV drip, that is 1 ml is equal to 15 drops. 1 ml is equal to 15 drops. Now how much volume you wants to infuse, that is, you see, if you want 500 ml to infuse, duration of infusion in hours means, if you 1 hour into 4 is equal to drop per minute, okay. And if you using microset, it is a microset, the drops will be 60. Here you need not to divide by the 4. This is the calculation for IV fluid. So what we have learned, if there is vomiting, if you have vomiting, if you have dehydration, remember, if you have dehydration, it's because of the vomiting or because of the diarrhea. Okay, so if you have dehydration because of the vomiting, IV fluid of choice will be DNS and NS, but RL is not given. But if it is diarrhea, the IV fluid of choice is RL. Definitely for RL. Remember, for NS you need to condition 2. One is hypovolemic shock. If patient is in shock, the IV fluid of choice is NS. If patient is in diabetic ketoacidosis with dehydration, that patient IV fluid of choice is normal saline. So this is very important. Another important word I want to mention: never give dextrose containing fluid. Never give dextrose containing fluid to cerebral edema. Okay, cerebral edema, never give dextrose. This is the gold standard. Thank you so much.